Hey everyone, my name is Joel. I'm a senior public health educator. I work for the City of Houston's Office of Chronic Disease Health Education and Wellness, and I specialize in health education as it relates to chronic infectious disease and also emerging diseases. So today we're going to have a little bit of an overview on the state of COVID-19, the state of the pandemic, and whatnot. And also our vaccination schedule. I know there's been a lot of changes as of recently when it comes to that. So hopefully we can get to cover a lot of that information. First of all, I want to address vaccination hesitancy. One of the main pointers that we would like to give our community members in here is the fact that right now we're at the lowest stage of the pandemic as that we have been at. Our positivity rate is under 4%, and our wastewater load is at around 75-80%, which means that the viral load in the system is low. And now it's the time to be vaccinated because the more people that we get to immunize, the less that virus has a chance to mutate and change and develop those new variants that are going to happen. The vaccine, still has a little bit of that side effects because you are getting a live virus inside of you, an attenuated live virus inside of you. That means that you might get a little bit sick, you might get a small fever, a little bit of a runny nose and whatnot, but nothing that should pose any kind of major threat to your health. It is important though that we highlight that despite the virus being low, we're still in a pandemic stage. We're no longer in that high emergency alert system that we were once, meaning that our public health system has been able to caught up to that demand, and so now we're more of a disease of concern, right? COVID's still in the system. COVID still exists, and we still want to mitigate, COVID and maintain that those vaccination numbers and making sure that we're still up to date. Our individuals that are at highest risk for COVID are those that are immunocompromised, that have any kind of ongoing diseases such as diabetes, hypertension, high cholesterol, but also people that have an that are immunosuppressant, so that have a suppressed immune system. But even a healthy individual that has not been vaccinated can still run the risk of developing COVID-19. And so one of the things that I suggest for individuals that are haven't been vaccinated is, of course, getting the vaccine. But other than that, hand washing is key, because COVID is contracted by having by touching an infected surface, or a surface that has been in contact with fluids of an infected person, and I mean respiratory fluids. And then washing your hands, making sure that you get a nice soapy hand washing for 20, 25 seconds, 30 seconds. That's the number one thing. Still, avoiding individuals that are feeling sick or feeling unwell. It's key as well. Making sure that you're avoiding high crowded spaces, and if you are in a highly crowded space, it's absolutely fine to still wear the mask.
All right. Thank you for sharing. My name is Keith Brown. I am the Director of Development for TIP, which stands for the Immunization Partnership. We do education and advocacy work for vaccines and immunizations. I also serve as the interim pastor of Northwest Community Church, which is in Northwest Houston. I'm new to Houston, just relocated here back in June. But when you start talking about COVID, it is, I had an opportunity to really be involved with COVID vaccines and all of that. You talk about hesitancy. I was in San Diego, executive pastor at a church there in San Diego when COVID first hit. And myself, like many people in the Black and Brown community, I was hesitant about getting the vaccine. I'm like, no, I'm not going to get that. But let me tell you what changed my mind. We had the church there, which was substantial in size. We saw people were passing away. The members couldn't go be at the hospital with them. We couldn't have funerals at the church. People had been at the church for 40, 50 years, couldn't have services for their loved ones. I kept seeing this, and then I heard the statistics that came out and said if you were vaccinated, then you stand less of a chance of being hospitalized and dying. And that changed my whole vernacular there. That caused me to change my mind. Now, we also ended up setting up a vaccination clinic at the church because in the Black and brown community, there's skepticism, and there was a lot there. We also had a testing site. So we had the best of both worlds. We would get people who were testing and we would ask them about being vaccinated. Now, we ran into a lot of hesitancy, and I tell you, it was some people that got belligerent. One of the things that kept coming up during that time is, do you remember what they did to us in the Tuskegee experiment? I've had people say, that's been a long time ago. Why does that keep coming up? Well, it's something that's passed down from generation to generation. And as much as we, dislike people still, dealing with that, it still comes up. And so there's been a hesitancy. And that's one of the things that I had challenges with, is helping them understand that it's better to get the immunization. Don't worry about those side effects and stuff like that. It's better to have the immunization that will keep you from being hospitalized and dying versus taking that chance. And I told them I like the statistics that said, I have a better chance of being around if I took the vaccinations. So we ended up getting a lot of people to convert to that because, places of faith are seen as trusted messengers. Pastors were seen as trusted messengers. And the fact that we had a vaccination clinic on site, that certainly helped us with conversion rate of getting people vaccinated.
Absolutely. We work in conjunction with a lot of churches, and we have a mobile vaccination unit that goes there and provides those services to the community as well. And like you said, you guys become stakeholders of that community. And so one of the things that aids us on the public health side of things is definitely that connection, that personal connection that you guys have with your community members. Because up to this date, especially us, Hispanic people and African American people do have that mistrust because of prior events that have happened and whatnot, and also because of a lot of the misinformation that's available out in the out in the media. One of the things that I like to, as a public health educator, that I love is applying a little bit of that public health theory. And there is a model that I like, that's the trans-theoretical model, which walks individuals through the stages of change of exerting a specific health related behavior. And one of the things that I love about that model is that if you give individuals the right information and you explain to them with clear and concise thoughts the benefits of for example, the vaccine, 9 times out of 10 they will make the conscious decision of going through with the vaccine, because you're giving to them all the information, you're answering all of those questions, right? And so I was just at a vaccine clinic at a church this past Saturday, and we're still getting folks that haven't been vaccinated, perhaps, that are making that step forward and saying, I think it's time for me to get the vaccine. And also at this point, we all know someone that has had the vaccine, or we all have relatives, friends, family, neighbors that have been vaccinated and that have that firsthand experience, right? But yeah, it's one of those things that the people that we serve look up and listen to people that sound and look just like them as well. So it is to us, it is very important to have that partnership with our faith-based organizations, for sure. I see
Well,
that. Go ahead.
No, I was going to say you're right, and even at this stage, we still see some hesitancy in groups, even though we're getting a lot of people still being vaccinated. One of the things that we did and still do now is just take surveys from people, asking them if they've been vaccinated, and if they have, great. What caused you to do it? When did you do it? But then there are some we ask, and they say no, and we start asking them some of the questions. Why are you hesitant? And you mentioned something about, misinformation, disinformation. That's still a big part of why people are not getting vaccinated, even today. Or they're putting metal in us, or they're putting trackers in us. what's all the ingredients in that. And one of the things that I use to combat that with people is, we go buy food, fast food, we drink sodas. How many times do we really look at the ingredients on those things? And some of that stuff in there is more harmful to us than the ingredients that's in the vaccine. And also medications. Do you ever get prescriptions from a doctor? And if so, how many times do you look down the list of ingredients and then understand what those different ingredients do? So we still have hesitancy today. A lot of it is the misinformation and disinformation, which is something that we fight. I didn't know that it was this difficult in Texas, but but there's a whole group of anti-vaxxers that's not only after COVID, but after all immunization.
Absolutely. And that misinformation, might not affect as much as someone that's healthy, right? A fully able-bodied person that has that immune response to be able to fight off that infection. But when it comes to the immunocompromised, it is a completely different ballgame, because those individuals run the risk of developing long-term COVID complications such as cardiobstructive pulmonary disease, asthma, upper respiratory infections, and whatnot. Even heart failure because of that overload on their immune system that's already compromised. So one of the things that we always suggest is to make sure that you're staying up to date with your COVID vaccines. And make sure that if you have a question, that you go looking for those reliable, verified sources: the CDC, the WHO, your local health department. We in the Houston Health Department are very open to that distribution of information. We provide handouts to people. We have classes, online repositories of libraries of classes that we offer. We go into the community and answer those questions. I work also on site as a post-vaccination educator. So when there's a vaccination event that I'm attending, I get those questions asked a lot, and make sure that if someone has any questions related to COVID vaccine, that I give them that information. And if it's something that's beyond my scope of expertise, that I know at least to someone to refer them to. And so the number, what I would say is, if there is misinformation out there, which there is, the number one way of fighting it is knowing your reliable sources, sources that are science-based, right? Sources that are verified by multiple entities, such as our CDCs, WHOs. Try to avoid the news media, and try to avoid social media as well, because those places can sensationalize a lot of the material for their own benefit. And so the number, I always direct people to our CDC page, because they're always at the forefront of that new information that's coming out and about. And so just very recently, as of April 19th, we started to get the new direction, that because now COVID is no longer an emerging disease but established disease, we're moving forward with a different vaccination schedule for a lot of these individuals.
Yeah, one of the things that we've done, as I mentioned, TIP, or we do advocacy work and education on vaccines. One of the ways that we've been doing it here recently, the session is going on in Austin, and so we've been going to committee hearings and making sure that citizens are reaching out to their respective politicians to let them know how they feel about this information that's going out. Now, they have an anti-vax group. And again, this is not just against COVID, it's about all vaccines or immunizations. And so the thing that we're doing is creating what we call vaccine champions, people that will go out in their various communities and stand up and talk about vaccines and the importance of them. The group that's out there that's anti-vaxxers spreading the bad information is a small group, but they're just loud. And we have to combat that loudness by going out and just making sure that we share in those areas of influence that we have. So if you're, a doctor, a lawyer, all of us have some centers of influence. So that's how we combat some of the misinformation, because granted, we're not going to be able to change people's minds who are of that mindset that, they're anti-vaxxers. We're not going to change them. I don't care how much facts or science we give them. But there are some people who are in the middle, and those of us who do believe with us. and hopefully we can get the facts to them, and they'll see the facts and the science and the data that shows that vaccines have been proven to be successful. And hopefully that helps us with the misinformation. I'll say this here with vaccines, the success of just basic immunizations have almost become an enemy for us, because we've kind of eradicated a bunch of diseases, polio, measles, mumps. So it's vaccines that have eradicated those things. And so vaccines do work. They've got a history of it. They've got data that shows that it works. And that's the same thing that hopefully we can get people to see with the COVID vaccine as well.
Absolutely. There is one thing that I always like to talk about, and it's maintaining a neutral perspective of things, is what we call the Scouts mindset. Going out there and not taking sides of anything, but get the factual information from one side, get the factual information from another, and make a decision based on that information without any kind of prior prejudice on a situation. That's one of the things that we as health workers like to implement, because science is non-dogmatic. So science is always changing as well. And information that we may have right now can change 3, 4, 5 years in the future, or even a couple of months in advance. One of the reasons why I touch on that is because right now we're in that transitionary phase between shifting from a emerging disease into established disease, and one of the things that affects is access to vaccination. As far as we are concerned, for the health department, in the meantime, we still providing those vaccines free of charge until we're told otherwise, right? And so you can get up to date in all of our mobile vaccination events that we have, and all of our community partners distribute that information with us, and so you can get that, but also you can get them on all of our multi-service centers that have that clinical aspect of it, and you can find all of those in our website, the HoustonHealth.org website. And so that's a key resource for a lot of these individuals, because if you don't have insurance, if you're low income or whatnot, these places will provide you that aid free of help until we're told that we're no longer being able to do that. Like I said, we're in that transitionary phase right now, so we get the information as it's rolled out to us. But we're still doing vaccination events, next week and whatnot, and I got a couple of them programmed for the weeks after that. And so that's the information that we can provide out there. Everything that we provide from the city, it's free of charge. All of our we also work with federally funded clinics such as Legacy, Casa de Amigos, and whatnot, and those places provide you care regardless of income as well. They usually do an income scale, making sure that they can provide you the care that you need regardless of your economic status. So yes, visit our website, HoustonHealth.org. Up in the top, you'll find a little COVID vaccination site little tab. You can find in there the closest clinic to your location. Also, you can find our mobile testing sites and our mobile vaccination sites as well. So yeah, I mean, it's an interesting time to be in right now, shifting outside of that global pandemic stage into a more long-term perspective of the disease. One of the most common questions that I get asked a lot is, will we always have to use a booster shot, right? And that's one of those things that the number one way to mitigate that is to reduce mutations of the disease. And the number one way to mitigate mutations of the disease is by reducing the able bodies that are able to host that disease and transmit it to others. Because when the virus jumps from one host into another, there is that genetic shift, whether it is a missense, nonsense, point mutation, or whatnot. It just codes for different proteins that build a different virus and a different variant. And so the more people that we vaccine right now, that the numbers are low, we're reducing that available gene pool. And so we're able to mitigate that long-term vaccination as much as possible. Even up until right now, we are sunsetting the primary and secondary dose, and we are only applying bivalent boosters. So those that have not been vaccinated, all they need is 2 bivalent boosters. two bivalent doses, which protects you against the original SARS-CoV, Omicron BA.4 and BA.5. So at that, we're no longer doing the primary, secondary, and then two boosters. Now it's much more easier to get up to date. Of course, there's differences for people that are immunocompromised, that are in 6 months to 5 years of age. And so if you have any questions regarding how many doses you need, whether you've had a dose before or not, what was the last one that you had, always ask your COVID testing site or your vaccination site, and we'll be able to provide that information for you. However, if you do think you have COVID, the number one thing you need to do is making sure you get tested. You can also find our testing sites on that website, HoustonHealth.org, making sure you get tested. If you come out negative, making sure you isolate and you stay away from crowded places. Make sure that you stay by yourself, avoid from other people for about 5 days, and then get tested again. If you still test negative, just write out your symptoms, but make sure that you're not out there with a lot of crowded places, because you may not have COVID, but you may have another kind of respiratory infection that you can still spread. Now, if you do test positive, the number one thing to do is, of course, making sure that you're up to date with your vaccines, right? Making sure that you isolate as well and quarantine for 10 days, and then test again. If you're going to be around people, making sure you wear your mask still to avoid that cross infection between you and other folks that might be in your house, or individuals that might be immunocompromised. So yes, we still have those tests, but the number one thing that you can do still is making sure you're up to date with your vaccines. Usually, as a rule of thumb, that I suggest, that bivalent booster came out in around November of last year. So if you hadn't had a shot after that, if your last shot vaccine that you had was prior to that November date, most likely you don't have that most up-to-date bivalent booster. Individuals that are immunocompromised, that have chronic diseases, diabetes, heart disease, cancer, COPD, or any of those conditions, are recommended to stay up to date with their vaccines. Based on the latest we've heard from CDC, even if you're up to date with your most current bivalent dose, if your medical provider suggests you can get one extra booster, bivalent dose of that available vaccine, that's based on your medical recommendations. But of course, we want to make sure that individuals that are immunocompromised still wear their masks out there, because you're at higher risk of developing COVID or any other respiratory infection to begin with. So
yeah, and it's important. Yeah, making sure you still get vaccinated even if you have some of those compromising diseases. And
Absolutely.
I know in the community, Black and Brown community, is a lot of these diseases are masked, and so people have diabetes, they have other issues, they're taking medications for them.
Mm-hmm.
And by getting COVID, that can exacerbate, or it can cause them to still, get very sick. And we have to remember, there are still people who are dying every day from COVID. And it may not be at the level of the emergency that it was, but the statistics that I look at say that we're still losing people every day. And the question I have for people, do you want to take that chance? Do you want to take the chance? If it says that COVID vaccinations will keep you from being hospitalized or dying, didn't say it wouldn't keep you from getting COVID, but if it can keep you out of the hospital on a respirator and keep you from dying, do you want to take that chance of not getting it and then you be one of the casualties? And so, yeah, it's so important to make sure that we get it. It's such an easy thing to do. Yep. And I say to people sometimes, do you want your fear to cause you not to be here?
I love that you bring that up, because I'm wearing my Avoid the Drama shirt, and so it's avoid the drama, get vaccinated.
Okay.
Because yes, it's one of those. I'm not just an ambassador of health, but I'm also a stakeholder myself, because chronic diseases affect disproportionately Black and Brown communities the most, right? So by us telling our people, hey, go get vaccinated. Avoid the chance of getting that disease. We're giving them a better fighting chance of living a longer, healthier, um, more life of wellness, right?
Exactly.
And so yeah, in my opinion, it is very important for to be working in conjunction with our faith-based organizations. Number one, because you guys work as our community liaison, as our stakeholders, um, as our boots on the ground, to be able to provide that reassurance that, hey, this is something that we're doing because it's for your benefit, right? We will not do something that's here to hurt you. We want to make sure that you're well taken care of, that you have every possible fighting chance to live a long, healthy life, and we care about you, right? And so, just to wrap things up, please visit our website. Go to houstonhealth.org. Get tested if you feel sick. Make sure that you stay up to date with your bivalent doses. Make sure that you take care of those people that are immunocompromised, right? And make sure that if you have someone in your family that hasn't been vaccinated, right now is the best time to get vaccinated, because we are that vaccine that we have, the bivalent dose vaccine. It's very effective, so effective that there's no need for a primary or secondary dose anymore. You get that bivalent booster, and then your second dose of that, and you're absolutely taken care of. If you haven't been vaccinated in a while, check in with your local clinic. If you have a healthcare provider that you visit, that's fine. If you don't have one, in our website you can find all of our multi-service centers, so you can get that vaccine there. But also, live a good healthy life. Make sure that you're staying active. Make sure that you're drinking plenty of fluids. Make sure that you check in on those folks that you haven't checked in on in a while. Stress does wonders to the body too, so make sure you stay you try to stay free of stress, and just be good to yourself, right. If there was a pill, that if I could take a pill that would ensure me that I would never be sick of anything, I would take that. The closest thing that we have to that right now is that COVID vaccine, right? So make sure that you're staying up to date in your self-care.
Yeah, and I want to say, let's make sure that you get the immunizations or the vaccines. They're still free in some locations now, but we don't know how long that's going to be. And again, do you want to take that chance when you have an opportunity to get vaccinated at no cost? Do you want to take that chance of not doing it and then it becoming an issue for you later on because there's a cost attached to it? So don't procrastinate. Go out and get vaccinated. So there he goes. Avoid the drama. Go out and do it for yourself, but not only for you, do it for your family and your loved ones.
Absolutely. It was great chatting with you, Pastor.
Oh, thank you. Thank
Wonderful
you.
conversation. I appreciate your time.
All right. You're welcome. Thank you.